My name is Dr. Tom DeMaria, and I'm with the National Center for School Crisis and Bereavement, and was lucky enough to come visit you guys several months ago. So I hope all's going well. Tonight's topic is when is it depression rather than just sadness? A topic that a lot of us are concerned about, especially since depression merits a lot of concerns. Now, the tricky thing I always find with children and teens is oftentimes parents struggle. They don't know what they're trying or may try to avoid talking about it, but they really have a hard time sometimes talking about their feelings, especially young kids. Now, the older children may try to hide their feelings because they don't want to bother others or be ashamed. So oftentimes it's really hard for parents to really learn what the children are really feeling or what's going on inside. So this presentation is going to really give you an overview of depression, sadness, so you kind of understand a little bit of the difference. Not try to make everybody here a clinical psychologist, but want to give you a good thumbnail in terms of knowing what's going on, and really for the purpose of knowing when you really may need to get a little bit more assistance to support your child. Now, part of the problem, because tonight we're going to focus just on sadness, is there's so many ways of describing sadness, and it's described in a lot of different ways, in literature, and it could be called sorrow, melancholy, anguish, gloom, dejection, misery, glumness, the blues. So times you and it confuses, because if somebody says they're in the dumps, well, does that mean they're depressed, or does that mean they're just sad? If somebody says they're in a lot of emotional pain, what exactly does that mean? So I'd like to kind of walk through what sadness is, if it's any of these words that are being used, or what was something's a bigger concern for parents, and that's depression. Now, emotions, to start off with, are complicated. There's two really classification of emotions, and this is a good way to kind of start our presentation. The first one is primary emotions. We share those with our fellow mammals, and they include things like anger, sadness, pain, disgust. If you have pets, your pets will describe those feelings, and if you don't have pets, those are something we all share. We all have those, and those feelings can come and go during the day. We can have a little bit of anger come in, we can have a little sadness. They're just common emotions that we, for example, in one day, be frustrated that you a little late. You might have been sad that you missed to watch a show that you wanted, a news show in the morning. You might have felt a little pain because your back was a little stiff, a little worried about traffic, a little disgusted because you stepped on the scale before you get in the shower. Happiness that you lost a little bit of weight. All that is in the course maybe of 5 minutes. So all those primary emotions are just something we feel. They're how we get a sense of how we're doing. Secondary emotions are a little bit more complicated. Those are emotions that we manufacture and we learn. Part of learning and development means we learn like guilt and shame and pride and heart, helplessness and disgust. To some degree, we learn all these emotions. So there's emotions we learn, and there's emotions we all have, and those are the primary emotions. So sadness, if you see, is one of the primary emotions. It's emotion that we all feel, we all experience, and understanding what that is, and understanding what anger and sadness and joy and all those other emotions are, is really important. So we'll try to separate at least sadness and depression for people here listening. So again, you might look at this chart and say, I've been all of that today, everything from exhausted to happy to frightened to cautious. Again, emotions are really very difficult and challenging. And sometimes with children, we have them look at posters like this and pick out all their feelings. Some they're feeling temporary, they're really feedback, and really are their feedback about how we're feeling, and they help us to do feel good feedback. They help us know where we're going and where we should be going. So emotions, before we get into the main topic, are complicated because there's a lot of ways we experience emotions. One way is, for example, objective experience. That's, some people feel happy, some feel sad, watching the same movie or hearing the same news. We also know that our bodies, are tied to our emotions. So when we feel sad, we may feel a feeling in the pit of our stomach. When we feel anxious, we might feel muscle tension or tension in our neck. And when we have these feelings, we show it on our faces. We want to do something. When we're anxious, we want to feel support, or somebody to help feel safe. When we're sad, we want to have someone to make us happy. So we'll do certain things. So emotions have a lot of different components to it. And that's kind of why feelings are so complex and so helpful to us, because there's so many parts of it. And that's why movies, books, other ways of expressing emotions to us help us in a way understand our own feelings and help us really begin to delve into a little bit more about what other people are feeling. So a key difference, and it's really kind of important to sort out a little bit, is that are basically reactions and feedback. They're just when something happens or we think something, memory can also cause feelings, a situation can cause feelings. They're just our reactions and feedback that our body is giving us in terms of what we should do. A mood is a collection of those feelings all grouped together that doesn't go away. It stays with you a little bit. For example, a sneeze is like a feeling. It's something that you have and not sneeze anymore. It might be due to an allergy or it might be something happening, but that's what a feeling is. It's temporary. It just will happen. It might be that we're allergic to something. It might be that there's too much pollen in the air, whatever. But feelings are like a sneeze. Getting a cold where you have fever, chills, a headache, aches and pains, a sore throat, a runny nose, all of those like mood. It's a function of a lot of different feelings, behaviors, emotional states that we have. And sort of what a mood is about. A mood is kind of like a syndrome versus a feeling is about just some feedback the body's giving to you. And we want to look to make sure whether those stay with us or those feelings go away. And often they can lead to not go away, and therefore they can be considered a mood. Now, a feeling of sadness or unhappiness is an emotion, as I mentioned before, experienced by everyone. It can be linked to a specific stressful or upsetting life event, and you obtain relief from the sadness by expressing the sadness, sharing it with others, looking at why you feel sad, and making needed changes to help you feel less sad. So, an emotion is temporary and usually goes away with time. Depression, which is considered a mood disorder, is mood disruption, interferes with the way you live your life. Remember that analogy of a cold versus a sneeze? Having a cold or the flu is a much more comprehensive process that doesn't go away right away. You can't take a medicine and have the flu just disappear. It takes time. Or the cold, sometimes it lingers for a while. And what we know about depression is oftentimes it can occur without something setting it off. It can just kind of appear. It could be, more biological in a way. It can be due to something that happens to you, but it can often happen just because your body or hormones are not. And children with depression, if their symptoms, which include sadness, occur every day for more than 2 weeks. Again, it doesn't seem to go away and it lasts a little bit. So if your child says they're sad because something happened, that's probably not depression. But if they keep talking about feeling sad and have some of those other symptoms I'm going to be talking about with you or those signs, then it might be depression. You might want to consider different options for yourself. Now, a good way to think about depression is it's a permanent rainy day. No matter what happens, it always feels dark and cloudy inside. And you always look at the world as being a rainy day also. Not that I have anything against rainy days, but it colors our perceptions, it colors our thinking. It's a deep, deep, deep negative blanket that encompasses us. And sometimes the world begins to feel darker. And again, that's that mood that seems to encompass everything that you go through, not just little things. It's enveloped by that depression. Depression in children is kind of important. So if you're listening, I commend you for being part of this because depression can have a big impact on a child's development. Because the depression, which is creating all these body changes, is occurring during a significant time of brain maturation. Remember, the brain develops well into when a child's in their 20s. So that time when a child, teenager is growing up, their brain's maturing. Depression could influence how they develops in the future. Also, personality styles are finalized or they become the person that they are during this time. So if they're in depression, it could influence how their personality ends up. And it's also a time in life where life and relationship goals are initiated, peer groups and role models are selected, health focus and lifestyle choices become habits, and emotional and behavioral management skills are learned and reinforced. So, for all these reasons, depression can cause a disruption in what your child can be and what your child should be. And that's why getting them with somebody, a counselor or somebody that can help them sort out this depression will help them not be stuck there where it could cause other more long lasting issues. Now, just to take a step back, just to look at the big picture, the National Center for Disease Control and Prevention looked at the most common mental disorders in children, and based on statistics they collected from children aged 3 to 17, and they found that the number one is attention deficit disorder with hyperactivity, which is about 9.8% of children in our country, which is 6 million children. Anxiety, wow, that was 9.4%, approximately 5.8 million children. Behavioral problems, 8.9%, is about 0.5 million children. And depression, about 4.4% of children. That's about 2.7 million children in that age grouping that suffer from depression. Now, what's important, though, is that really is talking about a broad range. But if we look at teens between 12 and 17, this is a startling statistic that 15.1% had a major depressive episode. That's a lot of teenagers having depression. And 36.7% had persistent feelings of sadness or hopelessness, which is, again, indicative of a depression. Just some other things that are kind of important to realize that about 1% had a substance use disorder, 1.6% had an alcohol use disorder, and 3.2% illicit drug use disorder. Now, we'll talk about the connection between depression and suicide, and it's why adolescents, we really are concerned about anytime suicide is discussed. 18.8% seriously considered attempting suicide, 15.7% made a suicide plan, 8.9% attempted suicide, and 2.5% made a suicide attempt requiring medical treatment, all which makes depression really something really, because again, and suicide are pretty much linked together. Now, I mentioned before that certain illnesses tend to, especially depression and anxiety, do get stronger as a child gets older. And you can see from the chart with depression that those teenage years get more and more pronounced in terms of when the children experience depression, but also anxiety. Again, the emotional change of puberty and growing up and life challenges and life demands and really affect our teenagers in a big way. And we got to be careful that they don't get stuck in terms of where all these feelings are. Now, when children have depression, about 3 in 4 children, 73.8% of those children also had anxiety. So depression and anxiety kind of can go together a little bit. And sometimes parents see their child as anxious, but they really depressed. And 1 in 2 children with depression also have behavioral problems, what we would call oppositional behavior, acting out, etc. Other complications with depression include alcohol or drug use, attention deficit disorder, bipolar disorder, post-traumatic stress disorder, eating disorders, injury, and children with chronic illnesses or physical disabilities are at risk for depression too. So let's talk about what we know about what causes depression. And I think that's kind of important because it can help us understand a little bit about that. Some of it is caused by things outside the child, but a good deal is sometimes caused by the internal part of who the child is. One source of internal causation for depression is the child's biology, the genetics, brain chemistry, and the hormones. And they're especially sort of at risk for depression if a parent, grandparent, or other blood relative has depression or has suicide, bipolar disorder, or alcohol use problems. There's a chance that they're at risk. Doesn't mean they'll develop depression, but it puts them at risk, which may need to intensify your focus. And as I mentioned before, certain health condition, chronic pain, disabilities, diabetes, for example, can have depression as something that goes along with it. So anytime you have a family member who's struggled with depression or alcohol use or suicide in the past, or if the child has any health conditions, you have to just make sure that depression is not something that the child is also experiencing. Now, external things could be a lot of things can set off depression on the outside. Poor stress management, exposure to traumatic events, victimization, peer problems, bullying, rejection because of their identity, culture, or sexual orientation, loss of loved ones or support, crisis, poor health maintenance, poor nutrition, poor sleep, poor exercise, failures in school, athletics. History of prior depression makes them more vulnerable, and history of prior suicidal thoughts or attempts makes them more vulnerable. Other mental health problems, substance use, body image issues, including obesity or any other type of bulimia or anorexia. Personality that the child's beginning to develop, low self-esteem, being overly self-critical, pessimistic, and learn pattern negative thinking. There is a type of therapy called cognitive therapy that looks at helping change those negative thinking. And it's been shown to be very effective in helping children and adults learn to shift away from depression, help the child and adult not feel as depressed. So I'd like to walk through the signs of depression because a lot of people have concerns. And remember, depression is a mood disorder. It's not sadness. And depression is something that lasts for a while with your child. And it's something that you want to intervene as soon as you can, because if it lasts, sometimes it becomes associated with other issues. And we'll talk more about the consequences later on. So one of the key signs of depression is obviously a persistent negative mood, where the child has an overwhelming sense of hopelessness and helplessness. They feel they can't do anything right. They can't fix or face any of their problems, and they lose hope. They lose the ability to feel that could get better. They feel sad, empty inside, and you find the child crying more often and cries for no apparent reason. Again, something that's just one part of the process of depression. There are other signs, symptoms that the child can have, but one of the ones that most people identify as this negative mood is something that's fairly common with depression. Irritability or anger. This surprises parents because people think that anger is a separate emotion outside of depression, but working in my clinical practice for well over 30 years, most adolescents who come in, you get depressed adolescents, but a lot of them come in pretty angry at somebody. And when talking to them, I realized that the anger is really a symptom of depression. It's not necessarily a goal in itself in terms of where I'm going to focus on, but oftentimes it's a goal that I need to look at working at with depression. And the anger sometimes shows up in being irritable, cranky, agitated, especially in teens, grumpy, hostile, easily frustrated, or prone to angry outburst, frustration or feeling of anger, even over small matters. There might be angry outbursts, disruptive or oppositional behaviors. So your angry teen or your angry child might be depressed. It might not just be anger as an issue. Again, parents want it to just be anger, but oftentimes it's this underlying depression. It can weigh the symptom in a different direction and look like it's anger, but it's really anger being a symptom of this mood disorder, this depression. Agitation and restlessness. The child is tense and restless a lot of the time, won't sit still, is pacing, his hand ringing and kind of looks like they're always restless. Again, it looks like they're being restless, but again, it's part of that agitation, which is part of depression. We think part of that is that anxiety influence. Remember, I said before that anxiety and depression concur together, and that agitation might be part of it. It might be something that it is hard for them to put down because they're struggling with that, the agitation and the depression, or as people called it in the past, an agitated depression. It's something that a child could be experiencing. Changes in energy. And this is hard because adolescents sometimes look like they have no energy, but it's less energy or motivation than usual. So that's where you, as a parent who know your child, will know the difference. It's like when I talk to teachers, they can spot a student after they get to know them that's a little off, something going on, because you need to see the normal level of behavior. And if you see the normal level of behavior, you can see when the behavior deviates a little bit. So you'll see with changes of energy, slowed thinking, speaking, or body movements, the child looks tired and sluggish. It's not just being lazy, although that's a hard term sometimes. Um, it's more that there's just low energy, low motivation, low drive, and you see that, and it's just so different than the way the child has normally been acting. Problems with thinking. There's trouble with concentrating, making decisions, and remembering things. And oftentimes, parents make the mistake of trying to talk the child out of being depressed. Remember, depression is a mood disorder. It's pervasive, and it's hitting the child in a lot of different ways. And to try to talk them through it when they're not taking information, it's really hard, and the child have trouble focusing and making choices and having a hard time paying attention. And sadly, it'll impact on school. And oftentimes that's how it's identified, that the child doesn't go to class because it just can't do it. Grades start to get worse. There's frustration with schoolwork. Students, that their mind is just corrupted. All higher order thinking process, just they're not there. The executive part of their brain is just not doing its job because this strong hormonal influence, the depression, is kind of causing them to not really be able to think as well. But also, parents will tell me as they cue for being depressed was there's less enthusiasm for what they like to do, because often teens and children will want to do what they want to do, what you want to do. But when they lose interest in what they want to do, wow, that's cause for concern. They don't want to do or enjoy doing fun things that they like. They may quit their sports team or show less interest in an activity they enjoyed in the past. They start to withdraw from family and friends and just want to spend alone time in their room and just don't enjoy anything that happy in the past. That part of life that makes them happy, that thing that gives them that joy. And again, the loss of interest is really important. And it was once called anhedonia in psychiatry as a loss of ability to find, seek, and want pleasure in their lives. Again, the mood is taken over them. The other adolescent energy, but impulsivity. They might run away from home or actually try to run away from home. They might engage in dangerous or high risk behaviors such as reckless driving, binge drinking, or unsafe sexual practices. And they might say things to people which they did not mean to say, which is not healthy, given the fact that people may react to them and they may put themselves in situations which may result in them getting injured or hurt or rejected. So we this impulsivity might be a way they're trying to feel better. They want to get all that adrenaline in their system to counter all those negative mood and negative thoughts that they're having. But again, it can result in more and more difficulties for the depressed child or adolescent. Drug and alcohol use, well, they might be using drugs and alcohol not just to fit in, and the drug and alcohol use become issues in terms of peer pressure, but sometimes children attempt to feel better or numb their emotions or not face their problems by using drugs and alcohol. Well, it's kind of their way they're trying to self-medicate in a way, but not in a good way because they're not really know what they're testing, and they also lose control by giving into control to the substance. And that's really a key thing. And when you work with an adolescent or a child these days, or even younger sometimes, are using drugs, it's giving up control to something that's not who you are. You want to stay in control because you want to have your life be to what you choose and what you want to do, not necessarily what a substance does. And the drug is oftentimes a temporary escape, but usually makes the depression worse. It's what happens, and it's a trap, of alcohol or other substances. They give the illusion that everything's okay, and they get this sense of euphoria or relaxation, but it fades because when the drug withdraws from the body, the depression can become even worse. And sometimes it could lead to more impulsive behaviors because it disinhibits and it gets rid of those temporary barriers that may keep the adolescent safe when they're not using substances. Low self esteem shouldn't be a surprise, and it kind of fits in for a depressed adolescent or child. And the child may suddenly believe they're ugly, a failure, a disappointment. And obviously, personal appearance is so big to teens, but they're convinced that they're ugly, and or they need to have a surgery or a special procedure because they're just so ugly and disgusting, they say. And it hurts us to hear. Hearing all the what children who are depressed sad to hear, and it's not meant to make everybody feel sad. It's meant to make us more vigilant, trying to help them. The child with low self-esteem also talks less and makes less eye contact than usual. They're looking down. The less interest in personal grooming or appearance. They wear dirty clothes. They pick up dirty clothes off the floor. They're not taking a shower. They feel worthless, useless, guilty. And a way to look at it is they lack that self-kindness that we all have to have. Despite how frustrated we can be with ourselves at times, we know it's important that we need to be kind to ourselves. We need to do things for ourselves that help us value ourselves. And oftentimes, with a depressed teen or adolescent, that's not there. Um, the depressed teen can also feel guilty. They may fix on past failures and mistakes and go over and over and over and over in their mind something called rumination. They just keep focusing on the horrible past things that they imagine doing. And they may have exaggerated self blame or self criticism. And they believe everything is their fault and they dwell on all these imperfections. And it's a trap because hindsight is always more accurate because we can always remember what we should have done or what we could have done, what we might have done. And it's a deception because we really don't look into, well, when we were there, what we were facing, what choice did we have, what knowledge did you have back then. And guilt is tricky that way because it confuses intention with responsibility. Because oftentimes children and adolescents don't intend to do anything that hurts on anybody else or themselves or causes them to fail. And it happens, just didn't know, blame themselves. Again, that negativity kind of can dominate them. And it's sad because they won't be able to get out of that because they stay so worthless they are, because they feel so worthless, they don't try to do things to give them worth. Sleep habits are another big factor. They have trouble falling or staying asleep or sleeping more than usual, or they get up those early morning hours at 2, 3 o'clock and they get back to sleep. Again, sleep disruption is problematic because the brain's developing. It's a chance to reset. And if they can't get sleep, it really robs adolescents of that opportunity to clock back. And that's really important for them. A change in diet, a change in appetite, or an adolescent has less or more. It could be cravings for food and weight. It could be decreased appetite and weight loss. Everybody says, well, you look great, you're losing weight, but it might not be great. It might be just if the depression is hitting them, and combined with low self-esteem, depressed mood, etc. It just might be part of this whole negative pattern that they're not really purposely doing. It's just something they're doing because they just have lost that zest for life and that happiness that they should feel. Pessimism, not being hopeful about the future, ongoing beliefs that life and the future are grim, bleak, negative, inability to anticipate future enjoyable events, and predicting that the future events will be horrible, awful, and catastrophic. And I think up how the mood causes the brain and the thinking not to think in a really healthy and good way. We like to call that emotional reasoning, that their negative mood is causing them to think in different ways. And we know that although feelings provide feedback, it's our mind really that directs us. But with depression, the mood takes over and the depression takes over, and it pushes the teen or child into directions that they don't necessarily should be thinking about, because it's their mood and not them who are making those choices. Now, one view of depression is that it's a negative view about the world, about their future, and about themselves. It's called the negative triad. The negative view of the world is nobody likes or cares what I do. The negative view about the future is I'm never going to be successful. And the negative view about themselves is I'm not good about anything. So there's no future, no world to enjoy or to discover, and a belief that they're not really good at anything, competence. So you can see these all interact. If you don't feel you're good at anything, then your future's not going to get better. And if you don't feel good about anything, sometimes you don't want to explore the world and discover all the wonderful things this world offers to us. Again, that's of a trap that depressed people and children get caught in. The other thing that we don't realize also, and I mentioned about people who have health conditions sometimes can become depressed, but having unexplained aches and pains could be part of depression too. Complaining about physical ailments such as headaches or stomach aches and frequent visits to the school nurse all can indicate that there's something more going on. It might be this depression that it might be inside that the adolescent's feeling, but they can't really put a word to it, or they can't talk about it. And it can cause them to think it's their body or their health when it's really their mood, this depressed mood. Don't forget, most children don't have a lot of experience with strong emotions. And because of that, sometimes they misinterpret what these emotions are, and they might think it's a health issue when it really could be this underlying mood problem. Related to that is they might think it's your problem, that you're causing them all this problem. Again, their negativity, their mood causes them to view the world in a negative place. So they might not see that you're trying to help them, and their depression might cause them to reject whatever help you give them. And again, that's all part of the whole depression process. Extreme sensitivity to criticism and shame. They don't like any rejection or failure. They don't want to have anybody judge them at all, and they need a lot of assurance. Again, that's also part of depression. And you notice that their social life has changed. They're spending more time alone and less time with their friends that they've had for a long time since they were in elementary school. They lose an interest, engaging with family and friends. Notice they're hanging out with a crowd. Sometimes other children are depressed. They start to associate it with more people who feel like they're outcast, when your child was never like that. That's where they gravitate. They gravitate to that negative group of peers. And as we mentioned at the start of the presentation, that's why it's critical to get this depression handled and managed, because you don't want it to cause them to drift into places and with people that are not really who they're most compatible with. Now, a question often comes up is grief. If you've had a loss, and how is that different than depression? Well, grief is the price we pay for love and being bonded or having a bond with somebody. It's different. Grief and depression can go together. You can be depressed when you're grieving, but grief is something that should come and go. It arrives in waves, but then it goes away. You can laugh and enjoy yourself, but then an hour later you can feel really sad. For grief's about. Depression doesn't go away. It's persistent. With grief, you feel empty, but depression, you feel that negative, sustained, depressed mood. With grief, as I mentioned, you can have humor, but with depression, you can't have any pleasure or happiness. With grief, you might have feelings of self-worth and self-esteem despite the strong feelings you feel temporarily. With depression, it's often self-hate. And with grief, suicidal or negative ideation can be expressed, and usually revolves around guilt, or they did or did not a desire to reunite with the deceased. But with depression, it really is about hating yourself, and the suicidal ideation is really directed at oneself. But anytime a child or adult expresses suicidal thoughts, you really need to have them evaluated as soon as you can to make sure it's not depression that's part of grief. It's really just grief, which should come and go. Again, it's a form because oftentimes be with the person who died, they miss the person who died. And with suicidal ideation, when one is depressed, it's about hating oneself or feeling helpless, hopeless. It's a different feeling. But again, that should be professionally evaluated. Now, a lot of studies are to find that the smartphone and social media use will change with depression. Depressed people or depressed children often go online more to escape problems. And you might, your son and daughter, if they're depressed, hiding their phone or computer from family members. They might start to leave troublesome posts on social media that other people let you know about. And you might, if you do look at their computer, visiting sites with a depression or angry content. And the other thing we're finding more and more with social media with depressed children who can't sleep, it interferes with sleep more because they just stay connected to this whole world that feeds their depression sometimes, and it doesn't let them get sleep, which can refresh them and help them. Now, part of what smartphones also do or do is they increase sometimes the fear that they're missing out or being excluded, and it causes the teen to compare their looks and their lives with those of their peers, so they feel even worse about themselves. And it decreases the amount of time being physically active. Sometimes being active can help you change your mood. Social engagement can help you, or developing to deal with whatever is bothering you. And sadly, that social media presence can result in increased social exposure and therefore bullying by other people. And certainly there are predators and what's called trolls, people who look to hurt people on the internet. And that can be what they're exposing themselves to. And all the blurring of the boundary between reality and fiction can also occur with the internet, because sometimes teens or children can't sort out that what people say is not necessarily true on the internet. It's just up there. And sometimes people may encourage them to stay depressed or be negative, and they don't understand that those are not helpful voices. Again, all this can be something where the child may escape to, but it might make their depression even worse. Now, I wanted to spend some time talking about suicide in a talk of depression, because in studies have completed suicide, 50% had a diagnosis of depression. So it is a big risk when your children or adolescents become depressed. And suicide is the second leading cause of death for people 10 to 24 years of age. Wow. And we know that there's high rates of suicidal thoughts, as I talked about before, and attempts among adolescents. And boys are 4 times more likely to die from suicide than girls. And girls are more likely to attempt suicide than boys, which can cause lasting physical harm to them. And guns seem to be the method for suicide in more than half of youth suicides. So obviously, if there's a depressed child or adolescent, making sure the guns you have are secured and in a place that the child does not access to is really going to be very important to think about. Now, again, these are warning signs. Your child may or may have not any of these signs or some of them. I just wanted to bring them up so you start to develop sort of a sense or ear to what talking about suicide is really about. And again, anytime a child mentions suicide, they should be referred, or you should have them find somebody, and we'll talk about how to find somebody to evaluate them. And there also is a wonderful suicide hotline that's available 24/7, and I'll go through that. But I want you as parents and you as caregivers to start to see whether your child may have been talking about suicide and you weren't even aware of it. So these are some of the warning signs or signs that the child is thinking about suicide. If a child is talking or joking about committing suicide or wanting to die, even though it was a joke or a joke in suicide, that's a warning sign. Saying things like, I'd be off dead, wish I could disappear forever, there's no way out, I want to kill myself, or obviously I'm going to commit suicide, are strong warning signs. Speaking positively about death or romanticizing, if I died, people might love me more. Giving verbal hints such as, I won't be a problem much longer. If anything happens to me, I want you to know I love you or I care about you. That's a sign that there's something going on, especially in a depressed adolescent, that might be a warning sign. Drawing, acting, or writing poems about death, dying, or suicide, writing a suicide note, throwing out or giving away possessions or belongings that were important to them, saying goodbye to friends and family as if for the last time, seeking out weapons, pills, or other ways to kill themselves on the internet or in the home. And that's another thing too, for any the pill you have are locked up and out of the way. You don't want to give access to a depressed child. They hurt themselves. And talking about the suicide of a peer or someone they know with you, again, that may be a sign that they're also thinking about them too. Talking about feeling hopeless or suicide is start to be portrayed as a solution. Again, suicide is an act of a disordered mind, and what can cause a mind to be disordered and not rational is oftentimes that depression. That's why I'm presenting suicide, as a risk that you need to be aware of when somebody's depressed. Talking about being a burden to others and not belonging, you would be better off without me, no one would miss me. Becoming suddenly cheerful after a period of depression, that may be that they've made that decision to take their own. Expressing odd thoughts, hearing voices that others don't hear, seeing things that others don't see. Preoccupation with death or looking to die. Self-harm or injury, purposeful cutting a thing in their hand, which is also called self-mutilation or self-destructive behavior. Engaging in reckless behavior or having a lot of accidents resulting in injury. They keep falling, keep hurting themselves. Well, that makes some suicidal ideation. Belief that suicide will bring the attention of others or cause others to regret how they were treated. Sometimes victims of bullying have that type of disordered thinking or non-logical thinking. And see suicide as an escape or a solution to their problems or a way of expressing some emotion that they're kind of stuck with. Again, the trick of a disordered mind is they think that suicide is a solution and they don't really engage in problem solving, see alternatives. They only have this tunnel vision that they only look at this as the only solution to the current pain they're in. Again, that's that part of depression, and suicide can be so scary and so dangerous for children. So there's a new suicide and crisis hotline. All children have to do is just dial 988, and it's open for adults too. And it's the Lifeline provides 24/7 free and confidential support for people and children in distress. It offers prevention and crisis resources for your loved ones and best practice for professionals in the United States. So you can call if you want to ask questions, if there's something that you want to get for, you want to get a referral. Certainly, it's a great, great, great resource. And it's simple to remember, 988. And it's a great resource that you can use if you have questions. Now, again, the talk was about sorting out growing pains because adolescents will go through things for a day or a couple of days. Depression, again, is a mood disorder. It's something that stays with the child. So you should ask yourself, how many signs of depression that were talked about does your child have? Does your child freely share how he, she, they are feeling? How long have the symptoms been going on? How severe are their symptoms? How different your teen is acting from their usual self? What have you heard from people who know your child about how the child is doing, especially teachers, coaches, and other people, or your minister, or priest, rabbi, imam? Has your child talked about death or suicide? Again, once they start talking about death or suicide, there's a real need to get them evaluated. But when their child is showing lots of signs of depression, you should get the child screened too, especially if they have signs. But these are questions you can ask yourself about whether you need to go that next step for your child. So when to seek professional help as well when the depression signs continue, begin to interfere in your child's life, or cause you to have concerns about suicide or your child's safety. You can talk to a doctor, a pediatrician, or a mental health professional trained to help them. Again, your child's pediatrician or your school can recommend somebody because they will work with a network of people that are important. And sometimes people believe that depression will get better, but most often than not, depression doesn't get better on its own. It stays and stays. And again, going back to the earlier discussion, it is a very important part of teen development. It's an important part of their life. And you don't want it to get worse, lead to other problems we talked about depression can lead to. And as I mentioned all throughout, that depressed teenagers may have big risk at suicide, even if signs and symptoms don't appear to be severe. So you always got to be careful if it's your child that you think is depressed to make sure that suicide is not something that's seen as some type of solution and all part of that distorted thinking. Again, depression colors and affects the way the child sees the world, sees you. It's a syndrome that causes them to not think in a good way. It clutters their thinking. It tends to make them view the world as negative, the future is negative, themselves as negative. That corruption to make some very bad choices, seek solutions from their peers or online. They may not be in child's best interest. You as a parent or caregiver want to be the one to direct them for that support they need. You don't want them to find or seek information from other people. And that's where it's really important. And again, if you suspect your child has a bunch of these depressive symptoms that you've seen, you should consider having them evaluate, talk to somebody in the school or your pediatrician. Obviously, if the child does have any suicidal risk behavior or any of the signs we talked about, you don't want to have to make that decision. You want to have somebody who can effectively talk to the child and assess about whether they are at risk. That's really very important. So the purpose of this is to give you a better sense of what's going on with your child, a better sense of what you can do to help prevent this syndrome, this depressed mood from continuing. But again, a child could be sad for a day, or a child could be sad at something. Depression is a little serious, and obviously it has implication of suicide, which as parents need to be aware. If you need to learn more about the resources used in the presentation, certainly you can contact us and we'll send them to you. A material is from professional organizations, the American Psychological Association, American Pediatric Association, American Academy of Pediatricians, American Academy of Family Pediatricians. So these groups and put together this information, but I can get you specific resources if you contact us. And we'd like to find out if you found this workshop helpful. And there's a barcode I'm going to leave up for a few minutes on the next page. If you can use your phone and take a picture of that, it should bring you to a website, and it would only take a minute or so. It's nice to get that feedback that can help us better evaluate how effective these presentations are. And certainly your district can help you if you have more specific questions, depression or suicide, or how to evaluate your child, or how to help they need. One thing I can tell you is we have some outstanding treatments out there, both medications, if that's what your child needs, psychotherapies. I mentioned cognitive behavior therapy, but there are other forms of therapy that might be also very helpful. There also is wonderful medications that can help children, and the field of child psychiatry has grown by leaps and bounds. So if that can help you not get caught under depression, to not affect how their personality, social life, health, etc., I would encourage you to consider that too. Thank you very much for listening, and best wishes for you and your family.